unions that represent healthcare workers in this state. And our first speaker is going to be Billy Gallagher, assistant to the Vice President, Dennis Trainer.
Good morning, sisters and brothers. My name is Billy Gallagher. I am the assistant to Vice President Trainer, and on behalf of the 150,000 CWA members in District 1, including over 20,000 healthcare workers, I stand here in solidarity with you. We're here today because our healthcare system is in crisis, and it has been in crisis for a long time. Too many of our healthcare heroes are being forced to care for too many patients at a time. And as a result, is that the workers and patients are forced to suffer. COVID pushed things past the breaking point, and now we're dealing with a broken system, broken healthcare workers, and patient safety is at risk. In 2021, we finally passed the Clinical Staffing Committee law to make improvements, but we're not getting the help we need. And so last month, CWA submitted almost 8,000 documented violations of the law to prove to everyone what we know already. The situation in our hospitals is just desperate. It's a 5-alarm emergency. Again and again, we see cases where nurses are forced to do the impossible and cover too many patients at the same time. Having to make decisions they should not have to make on who to help first and who has to wait. Our entire patient care units without enough staff to change, clean, or bring patients their medicine. And despite all that, CWA members still manage to lead these staffing committees to hold management accountable for breaking the law and putting patient safety at risk. So thank you to our frontline healthcare workers who care for us and our families when we're sick, and who stand and fight and stand up and fight on behalf of their sisters and brothers and behalf of all their patients. Safe staffing saves lives, and we're making sure that the Department of Health and New York State do something about it. Right. Thank you, brothers and sisters.
All right. Thank you so much, Billy. We are also standing here today with the New York State Nurses Association, and as our next speaker, we'll welcome Pat. Thank you so much. A fierce fighter for healthcare workers.
Hi, good morning, everyone. Thanks for being here. So we're here today to really talk about real solutions to the staffing crisis. Our nurses every day are put in situations that are unsafe for them and their patients. We hear all the time that there's a shortage of nurses, right? Yes. Is there a shortage of nurses? No. There is not a shortage of nurses. There is a shortage of nurses that are willing to work in these conditions that we're seeing today in our hospitals, nursing homes, home care, in every single sector, right? We've seen, why don't you say a few words for me, Gershon, about where you work? How short are you every day?
We're very short. That's causing lack of care for our patients, burnout, causing the nurses to call out, and it's just terrible. We need safe staffing, we need more nurses at the bedside to take care of our patients.
So we're here to talk about real solutions, right? You're going to hear a lot of solutions from the industry about flexibility, about bringing nurses in from other states. We have nurses here that are ready and willing to work in their community if they can have safe conditions to work in. We need safe staffing, we need more ratios, we need the Department of Health to enforce the staffing bill that we fought for with all these other unions standing around us today. We need them to enforce that law, okay? That law has been in effect now for 2 years, and we have thousands of complaints that have been filed with the Department of Health. We need them to get on that and enforce that law. We also need employers to invest more in their workforce. We have nurses that are working that have been traumatized because of what they have been through. That is not being addressed. Their safety is not being addressed. They're subject to violence every day. Okay, we hear about the extreme cases, but there's way more than that going on in these facilities, and it's because of the lack of staffing. So we're here today to talk about real solutions, real investment in the healthcare workforce, what we need to do to recruit and retain nurses, and invest in the education of our communities, because we all know that healthcare education lifts up our communities as well as take care of them. So thank you very much for being here today, and we look forward to the hearing.
Safe staffing.
Save lives!
Safe staffing.
Save lives!
All right, next up, we're joined by a huge friend of labor, champion for healthcare workers, Assemblywoman C. Wright.
Thank you all. I'm Rebecca C. Wright, Chair of the People with Disabilities Committee, and I am a strong supporter of labor and our nurses, the backbone of our society. I represent the Upper East Side. I have 8 hospitals in my district, and it's a no-brainer that we need safe staffing. We need additional resources. We need respect, and I thank everyone that has turned out today for this rally, for this hearing that I fought for to hold before the end of the year on this important topic. So again, thank you for turning out, and let's get additional resources.
Thank you, Assemblywoman. Obviously, we're all out here for patients' rights, and this is about workers' rights. So we're joined by Brendan Griffith from the New York City Labor Council. Give it up. Appreciate it.
Okay, great. Thank you very much. Brothers and sisters, healthcare workers in New York are facing a crisis of understaffing that is actively undermining quality of patient care and threatening public health. These workers, as well as the working families who rely on them for healthcare, deserve better. Working families need a working healthcare system, and they aren't getting that when our experienced healthcare professionals are forced to leave their jobs because they're being pushed past the point of exhaustion. Decades of underfunding and staffing shortages have brought us to this point, to the point where these workers are caring for too many patients at once at the expense of patient safety as well as their own. The New York City labor movement stands in solidarity with the dedicated members of NYSNA, CWA, 1199, the UFT, and we call on all of our elected officials to make safe staffing and full Medicare reimbursement a priority in the next budget. Thank you.
All right.
Hi.
Hi. So right now we're going to hear from Assemblywoman Gunther, who is the chair of the Mental Health Committee and sponsor of the Staffing Committee, Safe Staffing Committee bill that we got passed.
I've got a big mouth.
Perfect.
I'm from the Bronx. We all have a big mouth. Right? So I'm here today because we know how important nurses are to the healthcare industry.
Yes.
So we are demanding safe staffing. And you know what? It saves lives. We've been fighting for this for years and years and years. We need to have this done and done now. You know, when we think about the administrators of the hospital and the amount of money that they are making on the backs of our nurses across New York City. So right now we're going to stand here and say, safe staffing,
Save lives!
let's do it.
Save lives!
Thank you.
Thank you. All right. Thank you, Assemblywoman. Up next, we have from 1199, Union Member Sheena. Sorry, I don't have the last name in front of me. Sheena Tanis. Hey, there you go.
Good morning, everyone.
Good morning.
My name is Sheena Tanis. I am a registered professional nurse and an 1199 member. I work at one of our safety net hospitals in Brooklyn, Brookdale Hospital. One of the things that I wanted to bring to attention is about the Medicaid reimbursement. Medicaid gives back 70% of each dollar of care that we have to render. Yet patients do not get 70% sick, nor do we give 70% of care. It is imperative that legislators close those budget holes. We as nurses, we as all healthcare workers need that type of funding to provide the care that our communities deserve. No one wants to be sick. No one wants to be in a hospital, but for the faith and the lives that we need to save, we need safe staffing, we need appropriate funding, we need the monies, because money is what is running this industry. We need the money to take care of our patients. Safe staffing does save lives.
registered nurse Amy Patchock.
Hi. Go, Amy!
Thank you. Hi. So my name is Amy Lee Patchock. I'm representing the New York State Public Employees Federation. I am an executive board member. I'm a registered nurse. I work in the surgical critical care unit at Stony Brook University Hospital out on Long Island. Since the pandemic, 1 in 5 healthcare workers have quit their jobs. Of those remaining, nearly 1 in 3 have considered quitting. In 2002, the number of nurses declined for the first time in 5 years. Younger RNs are leaving the profession at higher rates, causing the average age of nurses to increase. Job openings are steadily increasing while higher rates are stagnant. Understaffing affects patient outcomes. Adding 1 patient to nurses' workload increases the risk of a patient dying by 7%. It also increases the risk of a child being readmitted within 30 days by 48%. What is causing nurses to quit? Understaffing or poor staffing ratios. Safe staffing reduces workplace injuries. In California, where RN staffing ratio law has been in effect, workplace injuries have been reduced by 31.6% comparatively. New York passed their law, but work still needs to be done. Workplace violence is increasing in healthcare. From 2000 to 2020, assaults in hospitals grew by 144%. Healthcare workers are fatigued, overworked, with longer shifts and fewer breaks. How can we address this crisis? Improve healthcare worker safety with safe staffing ratios, reducing mandatory overtime. In New York alone, state healthcare workers work 22 million hours of overtime, costing New York State $1.35 billion. We need to pay our staff to keep our staff, attract people and keep them where they need to be, which is bedside. We need to increase violence prevention efforts too. There are laws in place that protect healthcare workers, but they are not followed. Efforts need to be made also to stop workplace violence and bullying within nursing. PEF has worked with Assembly Labor Chair Latoya Joyner to end bullying and abusive conduct in the workplace with legislative efforts. PEF wants the state to set clear standards for workplace conduct and abusive bullying behaviors because this also affects safe staffing. We can address safe staffing ratios by paying healthcare workers what they are worth, treating healthcare workers with respect, and honoring their humanity. Thank you.
Save staffing! Save lives! Thank you, thank you. Next up, we're going to hear from Beth Loudon, who's a registered nurse with NISNA. Beth?
Good morning, everyone. My name is Beth Loudon. I'm a registered nurse at New York Presbyterian Columbia campus. I work at Morgan Stanley Children's, and I work in the infant cardiac ICU. So that's tiny, tiny neonates that have congenital heart defects that we have to, do open heart surgery and recover them. So very specialized care that requires very specialized nurses that have been nurses there for a long time. Over the past 3 years or so, we have definitely seen a decline in our staffing numbers. It's not due to go chasing money or any travel insanity. It's the lack of respect. It's the lack of wanting to stay in a condition where we're just told to just show up and stay and do the work and not support it at all. I just got off my 4th shift yesterday, did an extra couple hours on the end of each shift just to get the work done, make sure my documentation was done so that I can protect myself. It shouldn't have to be that way. My hospital often violates safe standards, and staffing continues to be the issue. Nurses have to overcome a lot in order to deliver quality care in these conditions. In my context, a lot of the softer things get pushed to the side. When you're understaffed, you have to do just the basics. You have to keep the babies alive, fed, changed, turned, positions, medications delivered, emergency care provided if needed. But you may not have the time to get the baby out of bed, to do skin to skin with the mom, to teach mom how to breastfeed for the first time. These things that are vitally important for these babies going home and continuing to live a healthy life, that's what's being affected by short staffing. That's what we need you to care about. Each of our patients deserve having a nurse at their bedside to learn how to breastfeed, to do this patient education to allow them to go home safely and stay home safely, not have to return for small medical visits that could have been prevented by having a quality healthcare provider at their bedside as much as is contractual in each hospital. We sacrifice a lot, but we shouldn't have to sacrifice anything to do this job. The answer at my hospital to everything is more travel nurses, but that doesn't work, especially for my unit. As I said, you need a high skill training, and we're the only unit of our kind in the country. This is why nurses at NYP are trying to do all we can to enforce safe staffing. We filed for enforcement through our contract, and my unit was one of the units that we took through this process. I started tracking our staffing in February on a document. We filed for mediation in March, and their only answer was more travel nurses. We just finished arbitration, and we did successfully defend our case, and we won. We celebrate, but we know that's not the end of the road. We also tried enforcement through this staffing law. We filed dozens and dozens and dozens of complaints, whether it's for our bedside nurses, for our support staff, where we're supposed to have a unit clerk and a nursing assistant for every shift, every day. And it wasn't until last week, thank God, the Department of Health finally showed up. We heard they're actively investigating all these complaints that we've raised up, but we have also heard this is the first and only hospital they've done this so far. So what's the delay, and where are they in all the other hospitals? We have jobs where every second counts, and I don't think hospital administrations or regulators understand that. Otherwise, they would have responded with some urgency. We want them to respond like it's their baby with a broken heart, who needs enough nurses right now. We need management that is invested in safe staffing and not just looking at the numbers or thinking that underqualified travelers are the solution. Managers should push to hire more nurses, replace people who are retiring or have announced they're going to leave, and retain staff. They need to listen to the nurses and the caregivers and respect us. The Department of Health needs to be active and invested too. They need to stop listening to the lobbyists and the hospital management and start listening to the people doing the work, the nurses and frontline healthcare workers. They need to enforce our safe staffing law. Thank you.
That was so powerful. We really have to remember our healthcare workers are not machines, and they're not dealing with products. They're dealing with the most valuable things, right? Not things, humans, lives. And it's really shameful how they're treated. Next up, we have the new president of CWA Local 1104, Mike Ippoliti, representing
Good morning, sisters and brothers. My name is Mike Ippoliti, and I'm president of CWA Local 1104. We represent over 300 nurses right here in Lower Manhattan. We represent almost 4,500 graduate students at SUNY, about 900 telecom workers at Verizon, and more. And on behalf of all our members, I'm here to say I'm angry. I'm angry about how healthcare workers are treated. Healthcare workers want to save lives and provide excellent patient care. But the current conditions don't allow you to do that. Unsafe staffing puts stress on you, the patients, and the whole system. It's been going on too long, and enough is enough. Our hospitals and our frontline workers have been in a crisis even before the pandemic. They went through hell and back during the pandemic, and they haven't recovered since. Now, hospitals are saying there's a shortage of workers. They blame the workers for the shortage, saying they can't find nurses to do the work. But here's the truth. They can't find nurses who want to do the work under these conditions. They said work conditions make staffing safe, and you'll find enough workers to do the job. And that's why we're here today. We're urging our state representatives to help us fix the working conditions, provide the funding we need so hospitals can fix the working conditions, fully fund Medicaid to stabilize hospital budgets, and I guarantee healthcare workers will come. If we don't fix this problem, it's only going to get worse and worse, and more healthcare workers will leave bedside because they've had enough. CWA Local 1104 is here in solidarity. I brought the executive board, Chris Blum, our treasurer, and our EVP, Rich O'Neill, to stand with us for this fight. We will fight until we fix this problem. Because when we fight, we win! Because when we fight, we win! Thank you for all you do. Thank you.
Save staffing! Save lives! Save staffing!
Save lives! All right, next up we have another frontline healthcare worker joining us today, Levita Payton, CWA Local 1104.
Hello, everybody.
Hello.
Good morning.
Good morning.
Okay, before I begin, I have one question for everybody. I want you to think about this. Why are you here? We're here for one reason, right? We're here for our patients, to give them quality care.
Yes.
And the only way we can accomplish this is with safe staffing.
That's right.
My name is Levita Payton, and I am the Chief Steward of the nurses at CWA Local 1104. I have been in RN for almost 30 years. Throughout my career, I have worked in many different areas, including the emergency department. I remember countless days of wanting to quit due to lack of staffing, but I have not. I will not let my patients down and the nurses who count on me and everyone and our senators. Sorry, give me 1 second. I lost my space. Okay.
You're great.
I love caring for and protecting the safety of my patients, advocating for nurses' workplace rights, but with the current state of the workforce, it is extremely difficult. Why? Why is it difficult? It should not be difficult. It's because our healthcare workforce is in a crisis. Our healthcare system in New York State must be fixed.
Yes, it is.
Every day I see nurses suffering from burnout after only a few months and wanting to leave the profession due to the lack of staffing and the moral distress they experience. They feel defeated, like working conditions will never improve. But we are here today to tell the healthcare workforce that we will not be defeated. We are rallying with our union siblings from across the state because we care. We care about patients, their families, and the communities we serve. The DOH and the state must do more to protect the patients. And when I speak about patients, I mean providing caring to human beings, to our fathers, our mothers, our sisters, our spouses, our children, family, and friends. We are fighting for what we as healthcare workers deserve: safe working conditions and the right to provide quality care to our patients. Headlines across the country have spun a narrative of healthcare worker shortages. Let's be clear, the most urgent shortage is the shortage of safe and humane healthcare jobs. You know, the ones where nurses get lunch breaks, they get to go to the bathroom, and once in a while we may even smile. The workforce challenges facing hospitals across New York and the country is a direct response to the state of the current working conditions. Don't be fooled. How hard can it be to ensure safe staffing? We cannot continue like this. It is a disgrace and causes healthcare workers to leave the profession in droves. Study after study proves unsafe staffing and corresponding burnout, both physical and mental, have taken their toll on healthcare workers and causing them to leave the bedside. So what we need to do and what we are doing is we're calling on our elected officials and the DOA to enforce staffing plans and the safe staffing law. CWA just submitted over 8,000 staffing complaints to the Department of Health, detailing a statewide issue of short staffing. Let's address it. It's why thousands of healthcare workers, many of whom are here today, have been on strike over the last few years. We should not have to be here. This is a basic human right. We will not quit with it anymore. Furthermore, we need to see a real investment budget. The upcoming budget must fully fund Medicaid reimbursement and stop starving our healthcare systems of the resources it needs. Line after line, and we can't wait any longer. New York State must act now. Fund our healthcare system, enforce the safe staffing law, invest in our working conditions, and ensure that all New Yorkers receive the quality care they need and deserve. Thank you.
Every patient is a VIP. Every patient is a VIP. Every patient is a VIP. Every patient is a VIP.
We're here to call on our elected officials. We're happy they're hearing us today, and we're so proud that a lot of them have joined us here, standing with us. Assemblymember Burdick was just called in to join the hearing, but he also sends his regard and wanted to make sure that everybody knew that he's standing with the workers here. Okay, our next speaker is going to be...
One more frontline worker, nurse with NISNA, Pauline Wallace.
Go, Pauline! Hi, good morning, everyone.
Good morning.
I do not have a speech prepared because I'm so used to this, so I don't need a speech because we live this every day. I am from Kings County Hospital in Brooklyn. We serve the underserved, the poor. We administer care regardless of race, background, immigration status. Once you enter our door, you are taken care of. But our nurses are facing a lot of burnout because of the unsafe condition and the lack of staff. Management will say, oh, we do not have any nurses, but the working conditions, you cannot be operating an emergency room or an empty with the patient going above what was bargained. We have one of the contracts in NISNA, and we are continuing to ask the politicians and the people in power to support our staffing law, put pressure on the Department of Health to enforce the law that we fought so hard in Albany to get. So all I'm saying to everyone here and to the people who are making the decisions at the top, please remember our frontline workers. We work without any compensation during COVID. I remember private sector and everybody were getting all kind of compensation. We work like dogs, as they said, and a lot of our members died. So I do not want to see this again. So I am calling on all elected officials to do what they can, and we need Medicare for all New Yorkers living in this beautiful state of ours. Safe staffing, save lives. Thank you so much. Save lives.
All right, folks. Everybody, thanks so much for coming out. We really appreciate it. We're gonna head into the hearing shortly, and we're gonna win this. We're gonna
Real quick, take a, yes.
Okay. Let's talk about everybody.
Oh, everyone squeeze.
Squeeze. I'm definitely not.
Come on, Vicky.
Nurses in front.
Vicky,